Hi everyone. For my discussion, I chose to focus on the relationship between depression and suicide and sexual orientation. I chose to specifically focus on LGBTQ youth and the relationship between that population and suicidal behavior. I chose this specific population because, according to the Trevor Project, LGBTQ LGBTQ youth are 3 times more likely to contemplate and think about suicide compared to heterosexual youth, and they are 5 times more likely to attempt suicide compared to heterosexual youth. The article that I chose to read was specifically about the college population and college youth. The article was titled Minority Sexual Orientation, Gender Identity Status, and Suicidal Behavior. This article was looking at the effects between feelings of hopelessness and how they correlate to depression and suicide. So in this article, the researchers were looking at a sample of 349 college students. They were assessing the students first if they self-identified as part of the LGBTQ community, and then they performed behavioral assessments that were looking into feelings of hopelessness, depression, and suicidal thoughts. So the researchers had found that students that did identify as part of the LGBTQ community were more likely to have feelings of hopelessness. These feelings of hopelessness was correlated with higher rates of depression, which was then linked to increased suicidal behavior and suicidal thoughts. So from a clinical perspective, with everything that we're learning, this is extremely important to keep in mind, especially when we have a patient who's disclosing their sexual orientation to us. To be aware that this population is at an increased risk. The youth are already at an increased risk for suicidal behavior, but the LGBTQ community is at an even higher risk. So we want to make sure that once we have a patient, if we have a patient disclose us their sexual orientation, to then be doing further screening related to mood disorders, to depression, to suicidal behavior. We can also use this information to impact our public health. Suicide in general is a huge public health issue, and we can use different levels of prevention to help deal with suicide in our community. So from a primary prevention level, from an early age, we can start implementing programs that will help with social emotional learning skills, that will help teach coping skills, and educate students on different resources that they do have available to them in their community, just to try and prevent this from a primary level. So in students who aren't identifying yet with their sexual orientation, they aren't having those feelings of hopelessness yet. And we're giving them the tools necessary to overcome those feelings once they do have them, and for resources that are available to them to talk to others, to work through their feelings, knowing they're not alone. From a secondary prevention level, we can use the different screening tools that we have when we have patients who are sharing their sexual orientation, like I mentioned before. So making sure we're using those depression screening scales so we can determine who is depressed, and then assessing their suicide risk. So one of the major things in our reading this week is when you're looking at suicide behavior, you need to be direct. It is okay to directly ask, have you previously attempted suicide? Is there a family history? Do you have a family member who's committed it? Are they performing any risky behaviors that might be correlated with suicide risk? And making sure throughout this entire time that you're using that therapeutic communication, that you're being empathetic with your patient and really actively listening, taking in everything that they're saying, because that's an extremely vulnerable conversation. And then last, from the tertiary prevention level. So this will be working with patients who are survivors of suicide. So you want to make sure that you are referring them to support groups, that they have people that they can talk to, that they can relate to, who have been through what they've been through, and also making sure that they are receiving services from an interdisciplinary team. So they're being assessed from multiple standpoints, from a nursing level, from a provider's level, and making sure that they receive the care that they need.